When we started the palliative care clinic about more than 10 years ago, we started with very few patients. The journey started with 2 or 3 patients in the palliative care clinic, which was one room. And we used to see patients in that one room and in the hospital, in the wards, and over time it has really developed. Because currently, we are seeing patients in about 4 clinics. We are having a big unit which has over 10 chemo chairs. And before we used to see, for example, 2 patients in a day. We went to 10 to 20. Currently, we are seeing almost 40 over 40 patients in a day, and in a month we are able to see over 400 patients in a month. So far we have registered the 1,644 patients who are going through our palliative care services, and we have seen these patients come from very far and improve a lot. Before the palliative care services were being offered in Embu, patients used to stay home with that mind that I'm sick, I'm having a illness that I have to live with, and it's a chronic illness, I have to stay at home and wait maybe to die. When we started these palliative care services, patients now, they believe in themselves, they know they can come to us, to the palliative care department, we give care, and they are able to get all their symptoms, all their social issues, all their psychological issues, emotional issues, spiritual issues, all are able to be taken care of in the department at the palliative care unit, and they have been able to live a quality life.
SHA should be able to support patients wholesome, sio kwa ufupi tu. Mgonjwa akienda hospitali apate zile services na apate zote. Sasa jana kulikuwa na hiyo maandamano ili kuhamasisha serikali ama SHA iweze kupeana package ya kutosha, kwa sababu cancer treatment without palliative care haijafikia, na SHA ina support only inpatient services kwa palliative care, lakini wagonjwa wengi ambao wanahitaji tiba shifa ama palliative care wanahitaji kuhudumiwa wakiwa nyumbani, like an outpatient service. Hiyo ni one of the biggest gaps, na tunasema pia SHA wanafaa kuconsider, kwa sababu as I contribute to SHA, SHA should also be able to support me when I need that service. So outpatient support by SHA for palliative care is a huge need in this country, and this needs to be done today, not tomorrow, not progressively. Wanatuambia wata effect hii mambo polepole wakiendelea kupata pesa. Hapana, ugonjwa, pain doesn't know progressive. Pain iko leo, inahitaji kusotiwa leo, na ndio maana tunasema all policies should be all inclusive, kwa sababu kama ninaadhirika nikiwa nyumbani, nahitaji nipate hiyo matibabu nikiwa nyumbani ama nikiwa katika hospitali.
Most of these persons and families are stigmatized, they are hidden, and sometimes face a lot of costs that are very prohibitive. The purpose of celebrating is really to raise awareness that just because somebody has a life-threatening condition does not mean they should be excluded or their dignity should be taken away. So we pass the message that if you have a child, an adult who is facing life-threatening condition, or a family, they deserve dignity. Just because it cannot be healed, it does not mean they deserve to be in pain, to be dirty, to be stigmatized. So embracing compassion and passing that message is key in this day. We also want to pass the message that we have a policy in the Ministry of Health, a policy that is running from 2021 to 2030, delivering clear direction that it is not healthcare if it does not have palliative care, so that we decentralize these services beyond the level 6s and 5, everywhere up to the community level. The ministry in this regard is focusing right now on revising guidelines and to have standards and protocols to ensure that these services are accessible to every mwananchi in every corner, because this pain and these conditions are in every home, every community.
in Embu County, we are dedicated to and we are proud to say that we have a team that is dedicated in offering services to our patients. And the services that we are talking about are not solely at the health department sector. These are services that also our families back at home, we are embracing, and we are calling upon the people and the families to give it a priority, to give these patients that are in these situations that wellness and that belief that they are humans and they need this service to be administered to them. So we really appreciate that the national government has given the counties, as facilitating the counties, as empowering the counties to be able to offer this service to our patients. We all serve one patient, whether it is a national government, whether it is a county government. We really serve a patient that does not belong to any specific, either the national or the county, but we all share a common patient. So it is a collective responsibility that each one of us has to give services, has to offer these services to our patients in a more humane, more dignified manner, so that we also give our patients a reason to enjoy or to feel appreciated at these situations that may seem as if they are threatening their lives.
It is unfortunate kwamba katika nchi yetu ama in Kenya only less than 15% ama wagonjwa ambao wameathirika wanapata hizi services. That means the gap in care ni kubwa sana. Ndio maana shughuli kama hii ya leo ni ya umuhimu sana, ili tuhamasishe government, tuhamasishe county governments, ili kukuwe na response ama kukuwe na services, palliative care services in all our hospitals up to sub-county level. Ndio wagonjwa wote ambao wanahitaji hizi huduma waweze kupata. These services haziko kwa wingi, kwa sababu kama tunapoongea leo, we only have 124 facilities in the country ambao wana provide hii service. 124 kwa milioni 50 or over 50 ni kidogo sana. Changamoto zingine zimekuwa implementation ya policy ya palliative care ambayo tunaona inachukua steps kama za kinyonga implementing, but tunashukuru kwamba at least kuna hiyo policy na government tunahimiza ama tunasisitiza kwa government iweze kuimplement hii policy ambayo inaongea kuhusu establishment of services, access to essential medicines, na pia kuhamasisha jamii and as well as training of healthcare workers waweze kujua palliative care ni nini na inapeanwa namna gani. The achievements ambazo kuna dawa inaitwa morphine. Morphine ni dawa ambayo inasaidia makali ya uchungu, na morphine ni one of the essential medicines ya palliative care, na unapata kwamba mara nyingi inakuwa out of stock. Reason being ile process ya kununua na kureconstitute ama kuitengeneza kule KEMSA na kudistribute mpaka kila hospitali ipate, kuna bottlenecks, unajua steps nyingi za kupata hiyo madawa. Alafu sometimes unapata ikiwa katika hospitali hata ile prescription wahudumu wengi wa afya, madaktari wetu, nurses wetu, clinical officers wetu hawana ile training ya kutosha ya kwamba hizi madawa zikuwe well prescribed na pia wagonjwa wapate kuaccess kwa wakati unaofaa. Kwa hivyo one of the things that hospitali zetu hatuna wahudumu wa afya wa kutosha. So counties wanapoweka unajua pesa, because health is a devolved function, so tuna insist kwamba county wanapo prioritize zile needs ambazo ziko katika community ama katika county zetu waweze kuprioritize health, na wakiprioritize health pia wa prioritize palliative care. So that's our appeal, and it's a right, it's a human right, si kwa kuomba. Unajua kuomba serikali mara nyingi tunaomba sana, lakini ni vizuri walio katika zile ofisi waweze kufanya what they need to do, zile ambao wanafaa kufanya, na ile wanafaa kufanya ni prioritize every patient, so that every patient who is in need of palliative care is able to access it, either ako Embu, either ako Nyarukunga, either ako Mombasa, ama Northern Kenya, popote pale. So access to care, to health care is a human right according to our constitution.